Hello, my name is Tim Rowark and I'm the Respiratory Supervisor for the Children's Hospital. This is an educational video of how to tape an endotracheal tube using the HY method. But first I would like to discuss the role of the Airway Guardian. The role of the Airway Guardian is to hold the ET tube in the airway and have a single focus on the ET tube. Now, because these patients can become agitated and move frequently, you can use the palm of your hand and apply gentle pressure to their forehead to help reduce the movement. But the Airway Guardian's single focus should be on the ET tube and the airway. Now I'd like to discuss the role of the taper. The taper will measure the tape that they need, and it will go from ear to ear, and then we'll cut that tape. And then we'll cut a second piece of tape this same length for the Y, which I have already done. Now, before we apply the tape to the patient's face, we will clean it with warm water. We'll clean their face off. Give that time to dry. Then we will apply a protective barrier called Cavalon. And this is what it looks like. And we will apply it across the upper lip, on this cheek, and on the opposite cheek. Allow it a little time to dry, and then we can work on applying the tape. So for the H tape, I will cut a slit from this side to the middle and from this side to the middle. So this is what the H looks like. You don't cut it all the way through, you'll leave a little attachment right there in the middle. Now with the H tape, one leg must be shorter than the others. So I'll go ahead and cut that. And so this is what the H will look like once that leg is cut. Now, to make the Y, you only cut one slit from one side to the middle, and that's all that you cut. And this is what your Y will look like. The first tape that goes on is the H tape. And to peel the paper off the back, you act like you're tearing the tape, which this tape won't tear. And then you peel the paper off of the back. And then this is what it looks like. This top row of tape goes on the upper lip. As such. Your short leg will wrap around the ET tube first. And you'll need to tab the end just a little bit. The longer bottom leg will then be wrapped around the ET tube. And you'll wrap it around the tube in a spiral method to spiral up the ET tube. And again, you'll want to tab the end. There we go. Okay, and the H part has been applied. Now we will apply the Y part. And you can do it from either side, from this side or the other side. The important thing is that the perforation meets at the ET tube. Okay, so now I'm going to tear this paper off the back. apply the Y tape. So I want it to meet the ET tube, and the top part of the tape goes across the upper lip. The bottom part of the tape then wraps around the ET tube as such. And sometimes we will pinch this to keep the mouth from being occluded. And you'll wrap that tape up the ET tube again in a spiral method and tab the end. And that's how you tape an endotracheal tube using the HY method. Thank you very much.